Every morning is a battle just to get out the door. Homework that should take 20 minutes turns into 2 hours of tears. You're getting notes home from school and you're watching your kids struggle. And you know they're smart. If you're wondering what's really going on and whether there's something more you can do, stay with me because what I'm about to share changes how most parents see this situation entirely. I'm Dr. Dody from Dody Chiropractic Center for Wholeness in Littleton. We work with families from all over the Denver metro area who are dealing with these exact challenges. And of course, I can't diagnose anything in a YouTube video, but I can explain the brain and the nervous system patterns we commonly see in kids who are really struggling with focus, behavior, and school. Here's the first thing I want you to hear. This is not a willpower problem. It's not laziness. It's not bad parenting. And it's not that your child doesn't care. What we see over and over, and this is one of the most common patterns we see with kids who are struggling at school, is their brain and nervous systems aren't coordinating efficiently. That makes it genuinely physiologically difficult to do what everyone is asking them to do. Think of your child's brain like an orchestra. For them to sit still, process information, and regulate their emotions, different areas need to communicate in harmony. But when that coordination is off, the systems that support focus and self regulation just aren't working together smoothly. And their nervous system? It's often stuck in a subtle but constant stress response. When your body thinks it needs to survive a threat, it redirects resources away from the calm, focused thinking your child needs to get through a school day. So when you see your child struggling to transition from screen time to homework, having big emotional reactions to small frustrations, staying up late even when they're clearly exhausted, you're not seeing defiance, you're seeing a dysregulated brain and nervous system, and that's something we can actually measure and work with. Most families who find us have already tried a lot: medication, therapy, tutoring, reward charts, and organizational systems. And I want to acknowledge something important. You are not doing it wrong. These are not bad ideas, and many of them can genuinely help. But here's why they don't often solve the whole picture. Most approaches work around the pattern rather than on the pattern itself. Medication can boost focus while it's active, but it doesn't retrain the underlying brain patterns. When it wears off, you're often right back where you started. Many families come to us because the medication stopped working as well over time, or they simply want more tools available. Therapy and behavioral strategies are valuable. Learning coping skills absolutely matters. But if the brain's baseline state is dysregulated, you're essentially trying to teach someone to swim while they're being pulled by a current. What most of the approaches have in common is they start with the symptom rather than the source. We start by actually measuring what's happening in the brain and the nervous system so we understand the specific pattern before we do anything else. This is the foundation of our brain body method, a 3-step system: measure, train, support. Step 1 is to measure. We don't guess based on symptoms alone. We use a QEEG brain map to look for patterns associated with focus, calm, and regulation, and 3 state-of-the-art nerve system scans to understand whether the body is stuck in a stress response. This helps us personalize the plan instead of guessing. For most parents, this is the first time you actually see what's happening instead of just reading symptoms on a checklist. Step 2 is training. Once we understand the pattern, we use neurofeedback to retrain it. Think of it like going to a gym, but for the brain. We place small, comfortable sensors on the scalp, and your child watches a show, and the screen gives their brain real-time feedback. When their brain moves towards a calmer, more focused pattern, the show plays brighter and clearer. When it drifts, it dims slightly. And here's what calms most parents down immediately. Nothing is being put into the brain. This is purely feedback. Like a mirror, over time, the brain learns to spend more time in that calmer, more focused state naturally. Step 3 is support. The brain doesn't exist in isolation. The nervous system is the bridge between the brain and the body. For some kids, that support piece is gentle nervous system chiropractic care to help their body come out of stress mode. When we reduce interference in that system, everything works better together. Depending on what we find, we may also include targeted recommendations to support the whole process. I want to be completely transparent here because you deserve honesty more than a sales pitch. This is not an overnight fix. We're retraining patterns that have usually been in place for years. The brain learns through repetition and consistency, the same way you'd build any skill. And yes, sessions are typically a few times a week in the beginning because that's how the brain learns new patterns. In the consultation, we'll talk through what schedule is actually realistic for your family because we know life is busy. Many families tell us that they notice early wins like sleep and emotional regulation shifts first, and those changes tend to build from there. But the kind of progress that really sticks unfolds over months of consistent work. Every plan is completely customized to what we find in your specific scans. Two kids with the same set of symptoms can have very different underlying patterns, which is exactly why we measure before we do anything else. I'll be upfront, if you're looking for a same week miracle, we're probably not the right fit. And I'll tell you that honestly in the consult. Struggling with focus and behavior does not mean your child is broken. It usually means their brain and nervous system need a different kind of help. One that starts with actually understanding what's happening. If you want to find out if this is a good fit for your family, the next step is a free 15-minute doctor consult with me by video or phone. You don't need to come into the office, and most families do this from home. However, if you'd like to, we can do it here at our office in Littleton. Click the link below to schedule. And before you even book anything, go watch the next video, Neurofeedback for Kids, what a session is like. I'll show you exactly what happens in a session, what it feels like for your child, and answer the questions parents ask most. Go watch that next. I'll see you there.